Just wanted to share some ideas of best practice in supporting caregivers managing pets with chronic illness. And what I've found in my work as a hospice and palliative care provider is that it's best to build clinical practice guidelines around epilepsy within a veterinary hospital, within the service itself, so that veterinary teams can deliver consistency. They create the consistency and they deliver the consistency. So every family that's working with their pet with epilepsy has expectations going into it, right? So if they've had one pet with epilepsy, they know how this particular practice is going to help others, but always being open and fluid to new ideas and new therapies that might become available. So in essence, again, veterinary teams do well to build clinical practice guidelines around epilepsy. Then it's important within the epilepsy assessment to do a quality of life assessment within that. So to have an in-person meeting with the owner to review a disease trajectory, right? What is this condition going to look like in the earlier stages, in the later stages? And then to revisit an assessment often, especially as our patient begins to near the end of life. And we're going to know that through a myriad of symptom changes, behavior changes, where we really understand what death looks like as that patient nears the final days, potentially months of its life. And it's very important that veterinary teams are utilizing validated quality of life tools. And there's really only one, to my knowledge, that's truly validated the way that we like, and that's Vetmetrica by Dr. Jackie Reed and her team out of Scotland, that put together a really good tool to look at patterns and response to therapies. So how is our canine patient responding to what we're providing for them with epilepsy treatment, as well as potentially some other comorbidities that might be coming up? Those are other conditions that could be present for the patient as they go through the rest of their life. And then with regards to the time where we determine that the end of life is coming, and with regards to hospice care, we don't know if that's 6 months out from a natural death or a suspected natural death, 3 months out, a month out. It's really hard to say, because in veterinary medicine, we don't follow the same kind of care plans, as you will, that they do in human hospice, wherein a physician would say that there's about 6 months left of life. We don't generally do that in veterinary medicine, but when we can see that disease is advanced enough or age-related changes are advanced enough that we believe that death is coming in short course, then the veterinary team can work with the caregiver to create a very personalized palliative care plan. That is going to be addressing psychosocial factors, such as what Dr. Packer has already touched on, such as financial concerns, time constraints, possible previous experiences with euthanasia, with hospice care, and those things. The personalized care plan is also going to provide educational resources for pet owners to know, what this disease is going to continue to look like as death comes closer, and so that they are as empowered to provide good care as possible. There's going to be the regular assessments of the progress and how the patient is doing throughout the course of that treatment, as symptoms might continue to increase as we get closer to a natural death, even though euthanasia may be chosen. But we have to keep that conversation going. It's very important. And that's the last bullet there that says communication schedule needs to be established along with grief support. So in my experience of working with epilepsy patients, it's very important that we decide whether or not we need to talk daily, talk weekly, or maybe monthly, just depending on the seriousness of the condition. So expectation setting to protect that patient and caregiver quality of life. It is very much the ethical responsibility of the veterinary team to give realistic expectations and to include all necessary resource allocation. We have to empower our caregivers to be able to provide the care that they need to keep their pet comfortable and safe, content with as high of quality of life as possible. But sometimes veterinary teams have to go there. We have to have those difficult conversations. It's really our ethical responsibility to do so. And then talking about with caregivers, the difference between, a gold standard approach versus a spectrum of care approach. A gold standard is here is everything we can possibly do. Now let's do it, versus let's go ahead and try this. and let's try this and then try this. So a little bit more of a platter of choices, and then come to the best care plan for everyone involved. And then, of course, setting expectations within the veterinary team, including specialists, of what we think is possible with this patient's care, and having those conversations with our caregivers so that no one is set up for failure, that everybody is on the same team. We're all moving forward in a collective way, and to try to make it as enriching and rewarding as possible in this end-of-life journey.